with us today, and we appreciate your patience while we were working through some technical glitches. So this is a true demonstration of collaboration and teamwork. Thanks, Lisa. So today, we're excited to bring you an open dialogue of sorts, where we hope to have you participating as much as Bob and I are presenting to you. So with that as a background, what I would like to do is introduce you to the agenda for the day. So Lise, if you could just move forward one slide. Fantastic. So as I mentioned, the exchange was designed as a mechanism to, A, report back to you, our survey participants, which were comprised of leaders across the provider, payer, and pharmaceutical sectors, on the results of our survey, which you participated in, and more importantly, to create a meaningful dialogue with you, engaged leaders, on creating cross-sector collaboration to improve our shared purpose of creating healthier communities. So as I mentioned, as opposed to a lecture for 90 minutes, we're looking forward to sharing the data, engaging you, and collectively creating meaningful suggestions for next steps in the future. So our agenda is to do a brief round of introductions, since we're a small and intimate group, spend just a little bit of time talking about why we believe it's so important to take an ecosystem approach to health delivery, health care, and health in general for our communities, to review our survey results, and to provide our perspectives on leading across the healthcare ecosystem and learn from you in terms of your perspectives as well, given the data that we'll share, and then talk about the capabilities that are required to lead effectively, and then how we want to move forward in terms of next steps, if we want to continue the exchange and bring you together throughout the year to learn from you and so that you can learn from your peers. So we're excited. So next slide, Lisa. Okay, so you know, Bob and myself, just by way of background, TLD Group, we are a global talent development firm. We work exclusively in the healthcare industry with leaders and medical and scientific executives across the ecosystem. And our mission really is around aligning talent to execute strategy, and we provide a variety of tailored solutions ranging from coaching to educational workshops and leadership development programs, as well as consulting services. And Bob, I'll allow you to introduce yourself.
Thanks, Tracy, and good morning or good afternoon. I'm on the West Coast, so many of you are probably on the East Coast, so good afternoon to you. It's great to be here. I've had the opportunity to work with Tracy and her team for about the last year, and was heavily involved in the survey design and determining kind of what we thought we found from that. And I'm looking forward to being able to share some of those results, and most importantly, to hear from you about your thoughts around this challenge of leading in the health ecosystem. So great to be here.
Great, thanks, Bob.
Go ahead. Should we move to the next slide?
Yeah, we can move to the next slide, or if for those of you that are open to it, since we have a small crowd, if you wouldn't mind introducing yourselves, I'd greatly appreciate it. Just your name, your title, and the organization that you're representing would be fantastic.
I guess Tracy. Oh, go ahead. Oh,
great. Go ahead, Ira. Go ahead.
Oh, hi, Ira Klein. I am the Senior Director for Healthcare Quality Strategy at J&J, and just a physician by training, worked in academics, worked for 12 years on the payer side as well as clinical career, and now on the pharma side.
Fantastic. Welcome, Ira.
Thanks.
Next. I know we have some other folks on the line. Maybe there's a muting issue.
I have Gregory Sorensen on the line, but I don't think he's self-muted, so I can't unmute him.
Okay. Okay. Yeah, I see that there's a bunch of people here that are self-muted. So you know what we'll do? We'll continue and then hopefully have an open exchange as we get to some of the Q&A throughout the presentation. So Bob, I will hand it over to you.
Great. Thanks, Tracy. And again, welcome, everybody. Look forward to the conversation that we have today. So first of all, by virtue of the fact that you're on this call, you are really understanding what change is going on in the environment. We actually have a slide like this in a presentation that we did about a year ago, talking about the tsunami of change and all that. And of course, that was pre-election. And who knows what lurks under the waves as we move forward with the new administration and what they plan on doing with the ACA. But clearly, regardless of what approach comes out of the replace and repeal and replace work, the system of care today is not accomplishing what we obviously want it to from the standpoint of outcomes, and clearly in terms of the cost that people are experiencing in trying to access care. And the trends are such that, with the aging of the population, with new technology, with increased rates of many chronic diseases, there are a lot of things that are going to continue to push the costs of care up and the cost of coverage up. And unless we take a whole different approach to how we think about these issues, it's going to be a tough nut to crack. As our new president said, no one realized how complicated this really could be, although I think most of all probably did. At any rate, we believe that ultimately this much broader approach that takes a look at the social determinants of health as well as how we do the best job of providing high quality, efficient, waste-free care is really, really important. And then if we're going to take this broader approach, that the provider community can't meet that on its own, the payer community can't do it on its own, all the various sectors that support healthcare, all the various groups that support public health and community engagement, everyone's going to need to be part of the game if we're really going to have a chance to really make significant progress on both cost and quality and ultimately health of our people. So that's kind of where we are today. A lot of unknowns, but very clear that the approach is going to have to be different and broader. So which leads us to the healthcare ecosystem, which is the next slide. And there you can kind of see our definition of the ecosystem, and it's a whole variety of interdependent sectors, as I said, including providers, payers, pharma companies like the one that IRA works with, medical device, public health agencies, safety net organizations, and for that matter, we believe local and state governments, various community agencies. They're all part of this ecosystem that really, if they can begin to focus in on the overall goal of improving health and quality of life, that we can come up with some really powerful solutions that create great value and really does a great job of managing the resources to get to the outcome, which is really what value is about. And so this ecosystem is broad, much broader than probably initially meets the eye, and that's part of what you'll see as we go through the rest of the conversation today. So if we could go to the next slide, just to reinforce how broad it is, and we can kind of just quickly run around the various players. But the point is, as the players begin to show up on the screen here, is that if the unifying force can be the population health and great health care for all of our people, and that given all the variety of missions and stakeholders that each of these sectors plays, if they all can begin to unify around some common overall objectives and begin to explore solutions around that, that's really what we're striving for. and what we think is important. And it also means that but it's not easy to do. It's hard to deal with the different obstacles, and it's hard to overcome the challenges that such a complex task takes on. And that's why we believe that leadership becomes such an important ingredient in success, and we think it's worth it. And if we can go to the next slide, as we've been talking with folks like you, obviously reading a lot of the same literature that you're reading, we believe that if we can be successful at leading across this broad ecosystem, that is the way that, where we have consumers and value outcomes at the center, that's the way to begin to create the right kind of dialogue between all these different stakeholders, because they all share an interest in making sure that people are healthy and leading great quality lives. And that dialogue then becomes a platform for beginning to work through what we're going to try to achieve, to deal with the conflicts that are inevitable when you bring different players to the table. And it's also going to be where we're going to get breakthroughs in innovation and the kinds of solutions that can really begin to address the real problems rather than chipping away at the edges. So it's because we think this is so critical to why we're all in the healthcare and the health industry, is why we took on this research, to try to get a sense of how others felt about it, where they saw this as in the overall scheme of their priorities, and what kinds of things they were trying to accomplish as they began to work together. And that was the focus of the survey. And we'd now like to begin to give you a high-level view of some of what we learned from the survey that you and many others took the time to complete. So I'll turn it back to Tracy.
Great, thanks, Bob. So Lisa, you can click forward just a couple of slides up to industry sector characteristics. Okay, super, thanks so much. So we had close to 100 survey participants that represented multiple sectors of the healthcare industry, with the majority, not surprisingly, from the provider organizations. The rest were primarily from the pharmaceutical and payer sectors. The largest number of responding organizations were multi-hospital systems, followed by community hospitals, academic medical centers, integrated systems, and lastly, physician groups. 1/3 of the respondents operate in large urban areas, and another third are in suburban communities. The remainder are in smaller cities or in rural areas. 60% of the people who responded were in or are in executive roles, half of which represent the C-suite. And when asked to describe their respective industry sectors, the three sectors of payers, providers, and pharmaceutical organizations all perceive their own sector as results-oriented, hierarchical, and bureaucratic. Providers also indicated their sector is service and safety-oriented, payers as also service-oriented, and pharma as highly competitive. So no big surprises there, but it is interesting to point out that hierarchical and bureaucratic characteristics as cultural characteristics are oftentimes diametrically opposed to those that are needed to enhance collaboration and partnership. So next slide. Okay, so this is a busy slide, but we'll try to make it as simple for you as possible. So we asked, what are your organization's most significant external and internal challenges in thriving in today's healthcare environment? So all sectors, which you can see through the yellow highlights, saw the primary external challenges facing their organizations as the changing payment models and shifting regulatory environment. When asked to identify internal challenges, which is the second row, that were the biggest obstacle to meeting the external challenges, those were organizational culture, leadership talent, and the ability to develop new organizational capabilities. The current culture, overwhelmingly described as risk-averse, was also a major concern, And for providers and payers, capital and finance were two shared internal challenges. And for payers and pharmaceuticals, payer expectations were seen as shared external challenges, as well as workforce talent, which was an internal challenge shared between the two. So overall, these findings are not surprising. Providers, the largest sector represented in the survey, identified a strong focus on safety and service in their organizations. And this focus is very important, which emphasizes consistency and reliability. However, this can also create a tension with risk-taking and innovation, and the leadership focus that's important to meet the external challenges faced by organizations. So it's no wonder that enhancing leadership talent and building new organizational capabilities are significant internal challenges to thriving in today's healthcare ecosystem. So we summarize the challenges, internal and external, on the next slide. And what we would really appreciate here is to just have an open dialogue with our attendees, and we wonder, from your perspective, why you think talent, culture, and capability development are at the top of the list for internal industry challenges, and what kinds of capabilities you think are important to develop from the perspective of your own leadership or your own organizations and people that you work with. This is a shy group. So Bob and I had some theories about this, because, and our perspective is that you can have, structure and systems and organizations aligned in a particular way, but as we know, the work gets done by and through people. So if you don't have people working toward the goal of collaboration and being able to think outside the box, we think that is the reason why we see this as a large internal challenge to meeting the needs of population health.
Yeah, and Tracy, if I can just add to what you just said, clearly. At least our view of why these popped up. The bottom one's not surprising. It's about the new organizational capabilities, which could have to do with processes, could have to do with metrics, could have to do with a variety of things of that nature. The fact that leadership talent and organizational culture is there is not surprising, because the leadership that is in place in most organizations is the leadership that's been very successful at leading their organizations against a certain model and an approach instead of objectives and outcomes. And as those objectives and outcomes begin to shift, that requires leadership to begin to think about the world differently and to perhaps behave in ways that are different. And culture is really an expression of how the organization behaves, which is very much a reflection of the what tone leadership sets and then conveys through the rest of the organization. So, we're not surprised that these are the items that have come up, and in fact, it reinforces a lot of what we believe and that what we're going to be talking about as we go through the rest of the presentation. So that's been our interpretation. And again, as I think hopefully you've seen on the chat, if you're not able to give us your thoughts by unmuting and talking to the rest of the group, we'd love to hear any comments through the chat, and we can certainly reference that and share that as we go through the conversation. So maybe we'll just take a few moments and just see if anyone wants to add their thoughts or comments to what you see on the screen and what Tracy and I just talked about.
So while people are thinking and hopefully posing some questions, we can move forward to the next slide because it's a really interesting summary of the benefits of collaborations and partnerships. So when we ask survey participants what they perceive as the most important benefits of externally collaborating and partnering for their own organizations, they indicated overwhelmingly developing innovative solutions, and this was shared across all sectors. With responding to payment models shared between providers and pharma, and improving population health shared between providers and payers. So I wonder if there are any surprises here. Yep. Okay, so we'll continue forward on the next slide. When asked which type of healthcare organizations are your organization's most important points of collaboration, either currently or in the future, the responses were interesting. So many of these organizations are already actively collaborating beyond their own organization's boundaries. And given the predominance of hospitals and health systems in our survey, it's not surprising that physicians were noted as a major focus of collaboration. Working more closely with health plans and ACOs are emerging points of collaboration. There appears to be relatively little current external collaborations with less traditional partners that we know are increasingly important for community health, like senior care, public health, community agencies, or with the health sciences sector. In the future, organizations say they will continue to look for opportunities to collaborate with physicians and health plans, and it also appears that there will be some expansion of potential partners with behavioral health frequently cited as a focus for collaboration. The current and future points of collaboration cited by our study participants are important, and given the clear need to improve population health, the focus of collaboration needs to expand to better address the broad determinants of health. In fact, there was a recent Blue Ribbon panel report from AHA entitled The Learnings of Governance from Partnerships That Improve Community Health, and they suggest that hospitals and health systems need to serve as quote-unquote anchor institutions with a role of convener, integrator, and facilitator for community partnerships. So the question that I'd like to pose here is, why do you think that there are parts of the ecosystem that tend to be left out currently? In other words, what do you think about the fact that there are significant parts that don't tend to make the top 5 on people's radar screen, significant parts of the ecosystem?
And Tracy, I'm sorry, go ahead.
No, hi, this is Ira again. I just want to say that sometimes or frequently what drives the collaborations or financial motivations, and the top-cited entities have powerful financial incentives to either do certain things or not do other things, and the less cited entities have less clear financial goals, and they often have less developed systems to manage collaborations and partnerships, including even HIT and just some other basics that would allow for an interface or for some kind of arrangement. So you go where the money is and where it's easy to go.
Yeah, I don't disagree with you, Ira, and it's an interesting insight, because the value that's provided by these smaller agencies where there isn't necessarily a financial incentive or big money to be made, the value is actually quite large for a small investment.
Yeah, the problem is that it's hard to measure the public good or the non-tangible benefits. I mean, I agree with you. It's hard to get at.
Yeah.
You know, one of the things that's interesting. Sorry, was someone else going to say something? I want to cut off the conversation from our participants. Okay. You know, one of the things that Tracy and I were had a conversation yesterday with an individual who spends a lot of time working with communities around the country, trying to bring some of these collaborations together. And one of the interesting things that he said is, if you very often, if you go to any one of the groups of people who are listed as either current collaborators or, you know, not cited as people that collaborating well. So in other words, whether or not you go to the top cited or the least cited kinds of organizations, and if you go to each of them and say, what are you aware of in terms of who else in the community is working, not broadly about population health, because that's a tough one, but even about specific issues around population health. It could be obesity, it could be smoking cessation, it could be mental health kinds of things, a whole variety of things. If you go to any of these individual stakeholders and ask them, what are you doing? They can articulate that very well. And then you say, are you aware of what these other groups are doing? And the answer over and over again is no. So one of the things that Tracy and I found interesting in that conversation is that lots of these organizations that you see listed as potential collaborators are doing work that intersects with each other, but are not aware of the work that each other is doing, which is why there's a lot of waste in the effort, whether it's actual hard resources or time, which is also a very precious resource. But there's a lot of waste, and part of it just comes from a lack of awareness and a lack of dialogue. So that's part of why a lot of what we're looking at here and talking with you about is how do we begin to shift that to first begin to build awareness across the ecosystem about what each other is trying to do, so that you can then begin to identify effective points of intersection.
Thank you, Bob. That was really beautifully said, and you're right. I think that there's so much great work going on at the grassroots level, but it just hasn't bubbled up enough to really take the focus of some of these these larger industry sectors that are focusing on sort of more of the big ticket items. So I agree. The trick becomes, how do we begin to engage in people in common dialogue around a purpose that's meaningful to all, which is really population health. So I'm going to move forward in terms of the summary points of collaboration, and then we'll turn the mic back over to Bob in terms of our perspective. Just as a summary, 80% of our respondents view external collaborations as important or very important to realizing their strategic objectives. And as we reviewed, these are the top benefits around enhancing innovation, building new capabilities, improving population health and medical outcomes, enhancing access, and responding to new payment models. We don't know at this point what they'll be, but we will need to be prepared for anything that comes our way. But significant points of collaboration tend not to be the major focus, which is what Bob just asserted. What I'd like to do is talk a little bit about, or have Bob talk a bit about our perspective given our findings from the survey, and then talk about how we could potentially apply this moving forward.
Great. Thanks, Tracy. So it's probably pretty clear from some of the comments that Tracy and I have already made that we do have a pretty clear point of view, and that point of view obviously drove the kinds of questions we asked in our survey, and we believe some of the results you've just seen really reinforces the importance of collaboration across stakeholders. And we believe, as Tracy said, that it really needs to go beyond the usual suspects. And so what we want to do is we wanted to share some of the things that we believe are critical for these collaboration efforts to be successful. So if we could move slides and maybe go to the next one. So these are some of the things that we know need to happen. There need to be different capabilities built to be able to work cross-sector. It's going to require some new processes and perhaps some new structures. Doesn't necessarily mean you merge organizations, but you clearly need to have aligned processes and where appropriate effective structure, certainly at least for governing the various activities that may be undertaken. That may require policies, and obviously you need to, to a point that Ira made, is where do you get it? How do you create some alignment of incentives? All this obviously is not easy, which is part of why it probably doesn't happen as often as we think it should. This broader focus adds a lot of complexity, and it requires that people are able to build agreements that cut across very different organizations, different in the sense of what their values are, what systems they use, what incentives are motivating them, what metrics are important to them, and just basically their culture. And as we said, while organizations in our survey cited aligning systems and processes and program as a very significant challenge, not surprisingly, they've also talked about building trust among organizations, finding the right partners, and really building trust with different culture, where different cultures and missions are in place, and that trust is really foundational to success. So we believe these things that you see on the screen are important, and there's a foundation that needs to be in place for these even to be effectively brought to the table, let alone solved to and worked on. So what is getting in the way, which happens to be the title of our next slide. And while the hard issues, if you can use the hard-soft distinction, like developing capabilities and processes and policies, etc., are complex and critical, we believe that the most significant issues are ones of politics, culture, and the interpersonal dynamics that are present when you bring leaders together from these different entities. From a politics standpoint, there are always going to be turf issues. When you bring people together from different organizations, there are going to be issues of turf. There are going to be issues of who gets to make what decisions, how and who gets to control resources, who determines what measures success, which then often ties into how do we align rewards to what those measures are going to be. Those are all about culture or about politics, and then you get into culture, kind of how we do things and what we value. What is it that we think is most important to why we exist as an organization? And even things like perspectives on time. Some organizations have a perspective that speed is critical. Others have a more elongated view of what a process takes. And so when you get people who have different expectations in terms of time and culture and values and measures and metrics, that really produces a cultural issue, and it makes language difficult because you talk different languages, and it's very easy to have words misunderstood and taken out of context, or fail to appreciate the context that they're coming from, and that creates significant tension in the culture as the cultures of the organizations come together, which puts a huge burden on the interpersonal side of the leaders and how effectively they're able to deal with that, which means you then have to deal with what their personal motivations are, and you have to create an environment where it's likely that people are willing to sit down and dialogue. And that takes time, and most of the people who are in leadership roles in these organizations already have plenty of things to fill up their day. So to take the time to really work through, to just get the foundation started, to take on the tough, hard issues, it's a difficult thing for people to prioritize in their schedule. And the real enemies of being effective at working these collaborations and designing these hard solutions that we need, in addition to time, is quite honestly self-interest. We're there to optimize the benefits to our own organization, and that's how we as individual leaders tend to be reinforced by the cultures that we come from. And then skeptics, who are always looking for why this can't work, and looking for signs that it's not working. And one of the things that we saw is that many of the organizations in our survey characterized, as a matter of fact, across all the sectors, said that results orientation was a huge characterization of the organizations that they work in, which is great, and it's a obviously part of why they've been able to be successful. However, in this process, results orientation can become an overused strength and can actually translate into a weakness as it relates to collaboration and thinking across lines, given the time and the energy and the different mindset that's required, let alone the fact that there are going to be failures that are going to be encountered along the way, and how you respond to failure, whether or not you use that as a skeptic to say, I knew this couldn't work, or whether or not you begin to say, here's an opportunity for what did we learn from this, and how do we do it differently the next time so that we have a greater chance of success. All those things can really get in the way of the effective collaboration. So, given all that, it's no wonder that while these collaborations are important, it's very difficult for people to take them on and to really focus on them. So that leads us to, so what are we going to do about that? What's needed? And that's our next slide. And as you can probably tell from what I've just been saying, we believe these soft issues, which will continually arise as these collaborations unfold, are in fact the key. And part of what makes this important is this work is never done. As you're beginning to explore new territory, work with new partners, you need to expect that there are going to be some turns that don't produce the outcomes that anyone or certain parties that are involved want. And that natural tension of learning, of encountering challenges, of dealing with the tension points between the various missions and values and metrics of each organization will continue to surface. And so a lot of what will determine whether or not these efforts actually move forward to the point where they bear fruition, as opposed to turn back when they encounter obstacles, will have to do with leadership. And that's why we believe this issue of leadership is so important in this context, and why we've undertaken some of the work that we have. So that's a lot to cover. You can see we have on the slide here a pause. So we'd love to hear either through the chat or by people speaking up, what are your thoughts about this issue of the hard versus the soft issues, and how critical the soft issues are and leadership is with being able to then tackle the really complex hard issues. So let me just pause and see what thoughts people might be willing to share. Okay. Well, I will assume that silence means that you agree, and let us continue. So, what is leadership going to require? And if we go to the next slide, obviously there needs to be a compelling vision, and initially this very often comes from an individual leader, a convener, as Tracy said before, that it is least compelling enough to get people to come to the table for the first time. And then what becomes important is that when you have people at the table, they need to be engaged, which means that who's ever convened this group is moving from the selling role to the engaging role. And they need to begin to work with various stakeholders to mutually develop solutions, to modify the vision. One stakeholder can own the answers. It really needs to incorporate the points of view from all, and very often that may mean the big people in the room, the big organizations, may need to stop and listen to some of the smaller organizations who, by virtue of where they sit and the context they have, may have different points of view that could in fact be very, very important to developing ultimately a solution that works. So being able to do that and work together is important. That then leads the way to begin to be able to build the technical systems that we talked about, and importantly, to begin to make sure that you have the employees in the organization who are able to play whatever roles they need to play in whatever the new strategies and approaches and solutions are going to take. So this is what we think leaders need to do. In some ways, it's not all that different from what leaders need to do in general, but it's being done under this much larger playing field with greater complexity and more stakeholders, which is what we believe makes it so much more difficult to exercise the leadership and to get to these outcomes. And so we've tried to think about and begin to work on what is that leadership going to look like in the future. And that leads us to what we're calling HELM, which is the Healthcare Ecosystem Leadership Model. And in this model, it's founded on what I've just said, is the key challenge is to keep the group that assembles moving forward in a way that respects differences, manages the tensions that are inevitable, tries things, because many of these things won't have been done before, so it's not like we have a recipe that we can call on, learns and adapts from what is tried, and with a strong unifying focus on why are we all here in the first place, and what is the opportunity that we have if we're able to be successful at this. So that's what the leader needs to be able to do who's playing in this game. And we believe that can be summarized in the model that you'll see on the next page. And it kind of works, although this is not a serial activity. But if we start from the upper left-hand corner, as I think I've already said, the leader needs to have a vision that generates what-if ideas. What if we were able to work together to tackle obesity or diabetes care? What would that look like? What if we were able to bring in all these different players around these specific solutions? And to be able to bring those together and begin to evolve and adapt that vision as other stakeholders come into the room. As I said, you can't develop solutions in isolation, and you need to begin to bring people together. And so that brings us over to the aligned stakeholders, where you've got to be able to recognize that there are different interests that are in play. And part of what we believe is you've got to move away from getting to the solutions too quickly, because very often people start putting answers out without really understanding each other. And we believe getting that foundational understanding about what's important to each party is the basis by which you build the trust, which allows you to then build, generate different options for different solutions. And so recognizing the difference between a solution and an interest is really important, we believe. And as you then move forward, you're going to be encountering obstacles. This is where that whole thing around the politics that I mentioned earlier comes in. Who gets to make what decisions? Why are you playing on my turf? No, we're already doing that. We don't think we need to change what we're doing. It's working for us. And it requires people to begin to sit down and not walk away from the table, begin to say, you know what, we really need to talk about this. We really need to understand where each other is coming from. And ultimately, we need to ground ourselves in why we're all here. And again, this is not a one-time conversation. This will be an ongoing activity. And I'm sure many of you who work in large organizations today are seeing that just within your own organizations, as corporate deals with regions, as finance deals with operations, as marketing deals with operations. I mean, these boundary issues are not only in the ecosystem, but the ecosystem really begins to add more diversity to the interests that need to be managed and the boundaries that need to be managed, which makes it, again, that much more difficult. And then, as we've said, you need to be able to take forward. You've got to be willing to act, even when you don't know exactly what the outcome is going to be. You have to act with an assumption that what you're doing is moving in the right direction, and it's the right step to move us forward. And we're going to look at what works and try to keep doing more of that. And we're going to see what doesn't work and figure out what we need to change. And then we're going to go to iteration number 2 and number 3 and number 4. And all through this acting and learning, you've got to keep the stakeholders engaged, and you've got to generate back up and evolve your vision as you learn things from what you have tried. So this is the mindset and the capabilities that we think leaders who are going to be effective at doing this kind of work, at building these collaborative, innovative solutions across stakeholders that ultimately improve population health, reduces the costs of care because we've kept people healthier. This is what we believe leaders are going to need to be able to exhibit as they begin to work these issues. And with that, the question is, do we have that? What do we need to enhance that capability? How do we build that capacity in our existing leaders and in our leaders of the future? Tracy?
Great. Thank you, Bob. So we're in the home stretch, and then hopefully we'll have some open dialogue at the end. As Bob indicated, the problems that are facing our industry, they're too complex and wide-ranging for any one sector to solve independently. So we hope that at this point you agree that an ecosystem approach where we have interdependence really does have the ability to deliver on not only the critical strategic objectives of your own organization, but also the objective that we all have, which is enhancing health. So while healthcare organizations across the system are beginning to realize the value, it's really only the first step, right? Recognition is the first step. The next step really is around how you build the necessary organizational and leadership capabilities to do this work. And so we put some preliminary ideas here that we consider to be sort of a whole system framework for creating and implementing a collaborative talent strategy. And these are 3 of our initial ideas that we'd like to vet with you and hear about some other ideas that you might have as well. So the first of which is developing a health ecosystem strategy. It's complex, and an ecosystem is made up of powerful players, and typically they have disparate interests that are nested in larger market and governance systems of even greater complexity. So traditional approaches to strategy, design, and execution, which are typically organizationally focused, have to be changed, we believe. So to take an ecosystem strategy, we believe organizations need to think more broadly and invite other sectors into their organizations and at the strategic planning table, which is going to require competing management teams and boards to come together toward a shared common goal of population health. So we think that this is really the first initiative for a whole system framework around building ecosystem capacity. Secondly, we believe that creating organizational alignment is very, very important. This will ensure that the requisite resources and support are continually applied to create the conditions necessary to create ecosystem solutions. So a whole systems perspective on organizational alignment includes looking at the spokes on the wheel, so work processes, organizational design, values, leadership, management, et cetera. And when all of the levers are considered and aligned in the context of an ecosystem business strategy, With the talent strategy, you're off to a good start. You've got the necessary elements to support the development of ecosystem solutions. And then lastly, which we think is a lot of the work that we've done to date, which is defining the leadership capacity, is then taking it and developing leaders. We want to be able to enable health ecosystem leaders to have the types of skills, knowledge, and capabilities to be able to align their resources and other organizational resources and other industry sector resources to work collaboratively to meet the needs of population health. So this is really around the strategy to assess and develop and continuously develop high potentials around succession, et cetera, to enable leaders to really exhibit these types of capacities. This is really where the hard work is, but we do believe that with focused attention and with, most importantly, organizational commitment to this type of model, we really can make a difference collectively in co-designing solutions and collaborate toward population health. So I'm going to pause there and ask what you think, our panelists and our attendees.
Yeah, Tracy, this is Bob. So again, I think the nice thing about this work is that the process of building the strategy and creating the alignment is a great opportunity to develop the leaders. So they can, developing leaders is, I think probably people on the call understand, it's partially about, teaching them, but it's a lot about putting them in problems, having them work through and getting a feedback and having a framework to judge their actions against, and again, learning by doing. And I think the work of building the strategy and building the alignment is a great way to develop the leaders. I think what that takes is a mindset to making sure that that development focus is part of the work, not just something that's done off to the side. But I think if people do that with a clear idea of what the characteristics are that they're trying to build, which I think is what we try to share with folks here, and to then give people feedback and coaching around that as they're going through the work, is a great way to build the capacity.
Right. So Lisa, if you want to go to the final slide, which is really just our summary. We have committed to you to providing our white paper, which summarizes the entire survey and all of the results, and we look forward to your feedback on that. We also would be interested to know whether or not you found this to be of value, and if you think you and your colleagues from your own organizations or across your industry or throughout the sector might be interested in joining a community forum of sorts where we can openly share dialogue. This is very much of a presentation, probably too much so, but what we'd really like is for people to start to dialogue around this and share best practices or potential pain points in a small, intimate group where we can really think through what some solutions can be to help all organizations meet their goals of population health.
Actually, I think there's one more slide, Lisa, if you want to click to the next one that summarizes kind of what Tracy just said.
Yeah, there's just next steps. So we'll.
There you go.
Yeah, there we go. So what we'll do, because we have a very silent group, is we'll send out a survey after this to all of our participants and ask for your feedback. And with that, you'll get the white paper, and we'll continue to listen to you and provide some additional educational forums. And you know, we know that this is hard work. It may seem very overwhelming, but we do think that there's value in sharing and learning from one another and supporting one another. So we hope that we see you back for our next exchange, which will be sometime during this year. So thank you very much. And we did it in an hour, which is great. Thank you.
Bye-bye, everyone. Thanks for being here.
Thanks. Bye-bye.
Thank you. Bye-bye.